Who's been here the longest? You have, whatever, Ronnie's son.
Yeah, Ronnie's like, what? Okay, just making sure. I just was like, oh, because Carson was asking me, and I'm like, oh.
We'll just have Ronnie do it.
I'll have to ask Corey.
But I'll just run the meeting if that's fine. We're gonna call this meeting to orders. Can we have a roll call?
Lively. Ford.
Here.
Van Zant. Hopper.
Yes, here.
Webb.
Here. Consent agenda, that's approved. Regular meeting minutes, approved. Quality meeting minutes, approved. Medical staff meeting minutes, approved. Clinic report, CCO report, CO report, and the MRMC Emergency Preparedness Plan policy. And there's no delinquencies. Is there a motion to approve the consent agenda as presented?
I'd make that motion.
Is there a second?
Second.
Any other discussion? Call for the vote.
Ford.
Yes.
Hopper.
Yes.
Webb.
Yes.
No items were removed. Is there any remarks or inquiries from the governing body? Hearing none. Financial report.
Okay. While Adrian is out on maternity leave, I'm pinch hitting for the next 3 months, but she plans on being back in August. Hopefully you have all your reports, and I'm just going to go through the main summary one. But if you have any questions, feel free to stop me. We had some pretty good results, and so I've got some positive news to share. For the current month, our ADC was 11.83, 11.6 year to date. We have really been doing great on our average daily sales. As a matter of fact, the first half of May has been even higher than that. So kudos to, I'm glad that's going really well. And our case management team, I could talk about them. They do an incredible job. Even when we get down, they rebound rather quickly. So Medicare was about, on our acute side, was about 76%. Year to date 52, so that's good. We've seen a much higher Medicare utilization for the month of April, and for our swing bed, it was 97% compared to, and that brings us up to 90 year to date. That is about as good a payer mix as you can get for the hospital. So from a census standpoint, really good. Our operating loss for the month was $69,000. Which was about $61,000 better than what we've averaged on a monthly basis, and $14,000 better than we had previously. So one of our better financial months from that standpoint. Our net patient revenue was $1,337,672. We've been averaging about $1,262,000, so we're $75,000 better than what our monthly average had been as well. Our operating expenses were $1,421,000. We've been averaging $1,416,000, so about right on what we've been averaging, about $5,000 higher. But 94% of our net patient revenue, or of our operating expenses, are being reimbursed directly from that, which is a really good thing to be able to say. Patient days, we had 355. Our average is 351. Our operating expense, which is the most thing that we measure the most, is what is your operating expense on a per patient day. We were at 4,004, year to date 4,034, so just under what we had been averaging for the entire year so far. Again, we're 4 months in. Cash receipts, one of our better cash receipts months that we've had, but again, a lot of this volume driven. $1,645,000, we've been averaging just under 1.2 million. Now, keep in mind, and I'll talk about this a little later, Medicare, we've been building a receivable this part of the year for all of 2024. And we are going to have a receivable after we filed our cost report for 2023, and I'll talk about that a little bit. But the point is, we're also being underpaid at that time, right now, currently. So our cash receipts were, you want it to always be at least 100% or close to what you think you're going to get in your net patient revenue. We were at 123% and 95% year to date. Again, we still have a receivable, but collectively, what that means is that we're not overstating our net revenue. We're collecting our net revenue, and we're going to collect a little bit more than that. So if anything, we were conservative in our estimates. That's what you really want to see from a financial standpoint. Our operating expense per day, we had 30 days, of course, in April, so we were at 47,378, which is higher than what we've been running. which was 46,807 on average. But again, we had higher volumes as well. Operating expense we have cash of 996,000. So I'm going to go back, and we have 21 days on cash. So remember when I was talking about before, our biggest hurdle was making it through March, because March we were getting ready to get rid of that $96,000 a month in ERS debt. We have now officially retired all of the 2018 and back debt. And I know that it's hard to remember everything, but I will go back. I shared something with you before. In October, we had paid, and I say we, Cohesive, Mangum, everybody worked together. We had repaid $9.8 million in ERS debt that pertained to years before we ever came out here. Now, when we made it through the end of March, we had actually gotten up to about 10.4 million. So when you look at why AP has grown or why Cohesive has grown more, 10.4 million has been paid back for all the debt, ERS debt that was incurred. And some of this, even though it pertained to 2016 and 2017, we didn't get hit until just a couple of years ago, you know, from Medicare, because that's when they finally resolved all those cost reports. But that's important. And we've got one, and I've got something positive, hopefully, that will add to that. But at the end of the day, when the dust settles, right now, if things work out well, I think this facility can be ERS completely debt-free a year from today, by April of next year. The objective is to never incur it, period. You know, because the interest that you pay, it's not only a high rate to begin with, it's always 10% or greater just about, but it's not allowable on a cost report. So it's like the worst credit card freaking debt you can have. That's really, to sit here today and be able to say that we've gotten that far is really a blessing. So I think power a lot greater than me, I'll tell you that. But anyway, 21 days on cash on hand. So you see the net Medicare receivable, and it shows a payable of 1.6 million. Again, we have a higher payable, but we're going to have a receivable. So I can tell you right now, we just filed our cost report, and we had to get it in because it's due before May 31st. I was worried about, one, when you have a receivable, you don't want to wait because you want to get your money as quick as you can. The second thing is, unless we were living in a cave, everybody and their brothers seemed to dodge a tornado. So I didn't want to be sitting here this week and waiting or anything. Kelly, none of us did. We wanted to get that filed as quickly as we possibly could, you know, and not jeopardize missing that day because Medicare could start withholding your money. It's not a good picture. So anyway, that was done, and we are projecting 1.2 million. Now, usually it's a couple of months before we can get that. If we get it in July, we can apply this towards the outstanding ERS debts that's left, and again, get it paid off in April, and it'll save us about $209,000 in interest expense. That's not allowable. So that's what we certainly plan on doing. Sometimes Medicare will settle for less. You know, they'll say, well, you know, I'll pay you 95% of that or something, but it should be in that ballpark, and that's what we plan on doing to get this out as quickly as we possibly can. Secondly, when that does happen, they'll increase our rates for the days that we have going forward, so it'll be a catch-up for there as well. But cash-wise, you know, and Kelly, we have an AP call every Monday, and the team has really done a great job in helping us manage that, and it's taken a team of people to do it. But I applaud all the ones that are on staff, and I don't know if you've ever met Melanie or any of the others, but they're just sweethearts of people. I love her to death. So I'm glad I just had the opportunity to get to know her more over the last year. Anyway, so accrued AP, we have about 14.9. We have 14.8, but again, we are still building that receivable. And again, at the bottom, I have broken it out like we do every month and show here's the part about Cohesive. We actually have paid down the other vendors. So everyone else, we actually decreased still. We've decreased what's owed to them. So we're keeping everyone else current and paying those. We decreased what we would have owed them. And then ours overall has gone up 127,000. But we, again, I recommend, and still am saying this today, every excess we need to get rid of that ERS debt as quickly as possible. And then the cohesive loan, we made a $31,000 a month payment that we paid on that. But that's the high-level summary. Any questions that I can take on that piece? Okay.
Okay, cost report 2023.
Yeah, I just kind of covered that. That's the one right now that we just filed, and we plan 1.2 million is what we expect to get. Sorry.
Okay. Discussion possible action approve the customer order between Care Fusion Solutions LLC and Mangum Regional Medical Center for the BD Fixus Med Station ES equipment.
Yes. this
Do we
is-
need to approve the financial thing, or are you waiting on me?
No, that's the third one.
Oh, okay.
Yeah, you just present it, yeah.
Oh, okay.
This is, we brought the Pixis back that we previously discussed last month, so we can make a decision on it if we wanted to move forward with Pixis or not. I will tell you what's in your packet went down another, we did talk to them, and BD decreased their overall amount, $30,000 more overall. So it did give us a little bit more of a decrease. The Dell server decreased, within that 30,000, it was like $11, because it was $397, it's $386 now.
And they can't go up if we approve it tonight, or can they?
They can't what?
Can they go up?
No,
We would be locked into that contract.
we would be locked into this contract, yes, sir.
I know your hesitation, we gotta have a system in some way.
We do.
I would ask the financial guy, going into something like this, I mean, it's a lot of money.
Yeah. I'm the last person that
Okay.
wants to spend it all over anything, but, but if it's considering our options, it was the best.
It is.
That's what I think as well.
What did we decide, what did we, in the comparison last month, it was gonna be 8,000 a year for the whole year?
Difference.
No, more expensive than
Yeah.
what you're doing currently, correct? Wasn't that what it came down to?
Yeah, it's around 8,000, right around that.
So when you look at it that way, it's a lot easier pill to swallow,
But that's what we currently have, not
Right.
upgrading anything that we have to
Right,
upgrade.
right.
Yeah, so, absolutely.
And
So our previous quote was for $47.26 a month, and it's down to $39.40. That's for the system, not the server. And it's still 84 months. They just were willing to go a little bit lower for us to try to get the proposal done for us. And there is a 6-month lead time on this, so 6 to 9 months before this is completely done and installed, before we even start making payments. But Carnegie has a position to get their new one that they're gonna give to us, since our server is in such bad shape for the system we have currently. So we will take their position, they'll take our position, they already have fixes, they're just gonna get a newer one, a newer version, so they're willing to give us their slot.
The $17.50 you have to pay right now.
That's a one-time fee you don't have to pay, right? You pay when
You
it gets
pay
it,
at
when
the
it gets
time.
here.
Okay.
I'd make the motion to approve.
Is there a second?
I'll second it.
There's a second. Any further discussion? Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action to approve the BD general terms and conditions between Becton, Dixon and Company and Mangum Regional Medical for the BD Pixis Med Station ES equipment.
So that's the quote, and then we have the terms and agreements with it.
Item 11, right?
Yeah.
I'll make a motion that we approve item 11 as well.
Is there a second?
I'll second.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Item 12, discussion possible action, approve the removal of the Smart PO Access Agreement between Premier Supply Chain Improvement, Inc., Alliant Purchasing and Cohesive Healthcare Management Consultant for the hospital from Unicode.
This has been requested from Smart PO just because they want to remove, because it has some intellectual knowledge, company knowledge on what we previously approved and is searchable for them. They don't want it to be able to be searched and other companies utilize what they have in that agreement. It's not from us, it's from Smart PO requesting us to check to go with it.
This came up in the past as well. It still stays public, it's just on the Unicode database. That's why they were utilizing the share drive. That way all the stuff is on share drive access, instead of being accessed through Unicode.
I'd make that motion.
Is there a second?
I'll second it.
Call for the vote?
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action to approve the memorandum of understanding between MRMC and Diagnostic Imaging Associates for Radiology Services.
We already have this memorandum in place through DIA, so that all the other cohesive facilities. Ours was just signed by the previous management group, their COOs. We wanted to get ours updated. They're not changing anything. One of the things that it does state in the memorandum is we will utilize their credentialing, but still bring it to the board. They'll still have a say-so, but we're not gonna credential them like we were previously. Because that's what we were doing, and the agreement said we weren't gonna do that. So this is just to update our agreement because of that.
So previously, we were doing credentialing.
Kay was checking, that we were doing a background check a little bit deeper. This is saying, just like the previous one, that we will utilize what they give us. If they give us and say they're good to go, the board and the hospital is okay with what they're saying.
What liability is that for?
They will still go through med staff, they'll still come through the board, they still go through all the processes. We just don't do the background checks.
So basically, we let them do the background check, are we still reviewing that? Or are we just accepting that they're giving us a green light?
Kay will.
Yeah, I mean, it'll be still at the med staff level.
Yeah.
I'd make that motion.
Is there a second?
Second it.
Call for the vote?
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action for the service agreement rental between Millport, Sigma, and Mangum Regional Medical Center for AFS 8D water purification system.
This goes with our chemistry analyzer, it purifies the water because of course it has to be super clean to dilute down any kind of blood. And it also does the service agreement. It does not cover consumables and filtration cartridges, but anything that they have to come out and replace and fix. If you do notice, our prior cost was $5,800. They did try to go up on us to $59, and we went back to them and said, no, what's increased? Show us why this is increased, and it actually went down to $52.99 and 50 cents. Because we just, not gonna just pay an increase, because we'll increase every year. And we did do this exact agreement last year.
Is there a motion?
I'll make the motion that we approve it.
Is there a second?
I'll second.
Call for the vote?
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes. So there's some of the money we've lost.
Number 15, discussion possible action to approve the quote between TrueBridge and Mangum Regional Medical Center for Patient Connect software.
So this software is gonna be installed, it's a TrueBridge piece of software, but it will help with our outpatient scheduling of appointments, confirmation and reminders. Mainly used, it's not used in our clinic, it will be used for outpatient physical therapy, and any other outpatient visits that we do have. Talking with them, they do feel it will help them track their patients a lot better and give them a text message or a phone call. It is a $2,700 one-time fee, no annual fee, no monthly fee. It's a one-time fee is what CPSI or TrueBridge is telling us. And then this agreement goes with the term of our previous full TrueBridge.
And And this is just gonna be for outpatients, not clinic related,
Not
strictly
clinic.
outpatient like PT and that sort of stuff.
Yes, ma'am.
And we don't have the capabilities to do that in the current system.
Is our current system, it just is not turned on and implemented.
So to turn it on.
They're doing all manual, it's a book, paper, and a calendar book every month, every day. Chrissy, our physical therapist, literally has to go through it. If somebody calls, this way, if somebody calls and can't make it, it'll update on her side immediately if she's in a meeting or anything like that.
And we won't be paying a yearly fee when we renew the,
Correct. From what we've been told so far, isn't that correct, G? It's a
Correct.
one-time fee only, not a yearly fee, just a one-time.
I question that a little bit. I mean, not that, I'm not
I-
questioning
I know,
y'all,
I know
I'm
what you're saying.
questioning,
Yeah, we get it, we completely understand.
that doesn't make sense from their standpoint.
Is there a motion?
Do not, yeah.
Oh, so the remind's not for our therapist, physical therapist?
No, it's for the patient, it's for the patient, sorry,
Okay.
it's for the patient.
Okay.
Yeah, and they can get a, confirmation email, a confirmation text, and then a reminder if they want it.
I'll make the motion.
Is there a second?
I'll second.
Call for the vote?
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes, just like Hopper said, we're spending what we saved earlier.
Item 16,
I knew it
discussion
was
of possible
coming.
action for the affiliation agreement for student clinical experience between Texas Tech University Health Science Center and Mangum Regional Medical Center for student clinical services.
So, this is for 2 students that are going through Texas Tech right now, and multiple others if they want to come. They will follow a nurse practitioner in their ER to do their acute care clinicals. As you all know, they have to have the family practice and acute care now work in the ER and be able to do both of them. This is just an agreement between us and the school for them to come do clinicals here. They will carry insurance on them, their own liability insurance. So that's not a cost we're gonna incur.
I'd make that motion.
I'll second it.
Call for the vote?
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action approve the order form between My Health Access Network and Mangum Regional Medical Center for Health Information Exchange Services to securely access records in support of patient care.
This is a renewal agreement. We currently, we were paying $750, it did go up, the price you're seeing here is $58.95 throughout the year, and that's just a renewal fee for our yearly, or monthly fee for now. As y'all know, we all have to be a part of the health exchange now. And this is Oklahoma's health exchange, they are charging us for it. Now, I will tell you, we did watch a PowerPoint on some of this previous stuff that we did not have, like the care fragmentation, social needs screening that they're doing no charge for us. It was pretty extensive what we can do. And, this will do our inbound and outbound CCDAs to other facilities also. It will qualify for meetings we use for our EHR.
We have to have it.
Have to have it. Yeah, have no choice. Or state mandated. I think state and federal, correct?
I'll make that motion.
I'll second it.
Call for the vote?
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action approve the financial responsibility letter between Medline Industries LP and Mangum City Hospital Authority for opening a new account for Mangum Family Clinic.
This is just saying the Mangum Hospital, they're wanting to open a Medline account for the clinic specifically for better tracking and utilization of supplies through Medline. We're trying to maximize maximize our spending and getting the best cost effectiveness out of Medline. So this way we'll be able to track what they're ordering, what we're getting through who, and how much it's costing. It's gonna break it down a lot more by separating them. This letter is just saying the Mangum Hospital is still responsible for their bill. Any bill they incur.
There's no additional cost.
No cost whatsoever.
And it's basically just a tracking mechanism for us.
Correct. For Medline and us.
Right.
For your clinic, so you're not sitting
We
there
did one-
segregating and pushing things to the clinic.
We did one for our lab mainly because, the previous agreement we did with our GPO, savings, where we said 85% of reagents and stuff would come through Medline, so we had to open another account for that also. It's just tracking. Our materials management lady approves all, orders, so they can't go in and order 20 boxes of paper, you know, or 2 reams, you know, it has to be appropriate, so she will still supervise that.
I'd make a motion that we approve it.
Second.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action to approve the processing agreement between Enmar RX Solutions and Mangum Regional Medical Center for pharmaceutical return credit and disposal service.
This is just a renewal, no change in cost at all. This company, Enmar, comes out and does an inventory, picks up our, expired medications, gives us a little bit of the credit, takes them off our hands. We don't use them for much, hazardous disposal or non-hazardous medication disposal, just a little bit of disposal. That's it. This is the exact same agreement we have, it's just we didn't have updated one.
Basically, we would, it's gonna cost us, it's more of a benefit if we are just disposing of medication.
And being a pharmacy, you have to have a disposal company that can come in and dispose your expired items and put them down.
Right.
And if I remember right, Stericycle doesn't want them in their bins anymore, in their sharps containers. We
Really?
used to pour them in sharps containers.
You can actually get a fine for having anything that's not sharps in sharps containers.
Trash,
$10,000 per item the last I knew.
Yep.
Anything that's
Trash,
not sharps.
anything, so you can't
Yeah.
even put in that bin anymore.
No alcohol prep pads, no pills.
So I'll make that motion.
Second.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action to approve the credit application agreement between Amerisource Virgin Corporation and Mangum Regional Medical Center for pharmaceuticals, products, and supplies.
This is just to set up a credit application with Amerisource. We're gonna be able to purchase pharmaceutical supplies from them. Currently, we have Cardinal and that's it. This is to put a secondary company on there. Does not cost us anything currently, to set this up, and again, this is just a credit app.
And I will add to that, I literally went through, our senior management, our materials management and some others, and I looked at our usage and compared the Cardinal, what we're paying Cardinal to the Amerisource on all the things, and we want to pick the higher dollars and highest usage fees. And just about everything that I see, Amerisource Virgin was better. And dealing with them as vendors
So much better.
is a lot better as well. So I think this is going to save all our facilities money, and at the same time, it's also going to make things a lot easier to deal with our vendors. So I think it's going to kill a few birds with one stone.
I would make a motion to approve.
Second.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action to approve the member letter of participation between Amerisource Virgin Corporation and Mangum Regional Medical Center for pharmaceutical products and supplies.
Just need to, sign a letter, be a member, that's it.
I'll make the motion to approve that.
Second.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Discussion possible action to approve the credentialing of Schedule I list of providers for DI services. Sonia Langley, MD courtesy privileges. Michael Hawkins, MD courtesy privileges, with possible executive session in accordance with 25 OS 307B1.
Need an executive?
Yeah, we got a member.
Yeah, I do, but I was gonna ask anyway. I'd make a motion to go into executive session.
I'll second it.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
End session as of 5:37 PM. Is there any action to be taken as a result of the executive session?
I'd make a motion to approve the Schedule I list of providers for DIA services, giving courtesy privileges both to Langley and Hawkins.
Is there a second?
Yes, I'll second it.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Are there any other remarks or inquiries from any governing body member, hospital CEO, myself, or the hospital staff? Hearing none, is there any new business? Hearing none, I'll entertain motion to adjourn.
I'll make that motion.
Is there
Second.
Call for the vote.
Ford,
Yes.
Hopper,
Yes.
Webb.
Yes.
We are adjourned.